Good afternoon, everyone. Today, we are going to discuss the pneumonia. So, what is pneumonia? Pneumonia, or the word pneumo, comes from the Greek word air, lungs, or respiration. Base dito sa etymology, ang pneumonia nagaganap sa lungs natin kung saan nagkakaroon ng blockage yung pagpasok ng air sa katawan natin. So, it is the infection that inflames either one or both lungs air sacs, or also known as alveoli. So, what is alveoli? So, tingnan natin sa anatomy. So, ito yung lungs natin. First, we have the trachea. Ayan, yun yung trachea, itong long branch na to. And then we have the bronchi. These bronchi are the primary bronchi. Itong dalawang malaking branch. And then we have the secondary bronchi. Itong mga kadugtong o kadikit na branch ng primary bronchi. And then we have the tertiary bronchi kung saan nakakabit ang mga bronchioles o itong maliliit na branch. Ayan. Ito tertiary bronchi, and then ito bronchi. So, ang alveoli, nakakabit siya sa bronchioles. Ayun yung mga maliliit na bilog. Maliliit na para, kumbaga, pwede natin siyang sa prutas. Kumbaga, prutas siya na nakakabit sa branch. So, paano nga ba nangyayari ang pneumonia sa katawan natin? At ano nangyayari sa katawan natin pag meron tayong pneumonia? So, nagsa-start ang pagkakaroon ng pneumonia. One way is pag nagkaroon ng infection ng ating nasal. So, ayan. Pag nagkaroon ng infection yung nasal natin, bumababa yung bacteria papunta sa lungs natin. So, ayan. That is the first transmission. Ang tawag sa transmission na yan is the inhalation. So, kung ano yung ini-inhale ng ilong natin, na hindi na blockage ng silya natin, pumupunta sa lungs natin. And then, we have the other one transmission, which is the aspiration. Ayun naman yung tinitake ng ating oral or ng bibig natin, then imbis na dumaan siya sa ating stomach, dumadaan siya papunta sa lungs natin. And kapag hindi healthy lungs natin, hindi siya nalilinis. So, paano ba nangyari sa katawan pag may pneumonia? So, ito yung alveoli. Ayan yung mga maliliit na bilog. So, dyan sa alveoli, may tinatawag tayong air sacs. Ayan, itong air sacs. Sa air sacs, nagaganap yung pag-exchange ng oxygen and ng carbon dioxide. So, punta sa blood na, pag-exchange ng carbon dioxide and oxygen, napunta sa blood natin. So, dyan nagaganap yung ating respiration. So, ayan, nakikita niyo sa video. Ayan, dyan nagaganap yung pag-exchange. Ngayon, ito yung healthy lungs natin. Pag nagkaroon tayo ng pneumonia, ang nangyayari, nafe-fill up ng liquid itong air sacs natin. At pag na-fill up ng liquid itong air sacs natin, nagkakaroon ng blockage kasi yung exchange ng oxygen and carbon dioxide natin. Bumabagal yung pag-exchange, kaya nahihirapan huminga yung tao.
So, good afternoon everyone. Now let's continue to the causes, signs, and symptoms of the pneumonia. So, as you can see on the slide, the causes are the following: bacteria, viruses, fungi. So, ang mga uri naman ng pneumonia ay bacterial pneumonia, viral pneumonia, fungal pneumonia, and the last one is aspiration pneumonia. Pero ang pinaka-common cause ng pneumonia or pneumonia kung tawagin ay ang bacterial pneumonia. So, let's proceed sa bacterial pneumonia. So, most common cause ng pneumonia organism na bacteria is Streptococcus pneumoniae. Maraming means kung paano ito nakukuha. Unang-una, ang pinaka-common would be kapag lagi kang mawak sa mukha. Parang sa COVID-19, nakukuha siya kapag umuupo or kapag sa mga contaminated objects. Yung iba nagugulat lumalabas, hindi lumalabas ng bahay pero nagkakaroon pa rin sila even they have proper hygiene, pero kakaroon pa rin sila pneumonia. Kasi, if you don't know, many viruses and bacteria known to cause pneumonia may already live in your nose or throat. Ganun. So, let's move forward to the viral pneumonia. Ito, for me, medyo tricky siya. Kasi yung viral pneumonia come in two forms of lung infection. Yung kanina kasi, di ba, bacterial, which can be often treated with antibiotics, ganyan. And yung viral naman, hindi siya natitreat ng antibiotic. Siyempre, yung antibiotics are not used to fight viruses. So, commonly, tumatagal to ng 1 to 3 weeks without treatment kasi wala naman specific treatment pa sa viral pneumonia. So, makakuha naman ito through air droplets of fluids. So, after umuubo ng mga kasalamuha mo, so yung fluid na yun can easily invade to your body through your nose or mouth, diba? Madali din tayo makakuha ng viral pneumonia kapag nagko-computer sa labas before kasi diba, di naman nalinis mga keyboard sa computer shop, yung ganyan sa hawak na mukha, sa mga doorknob, ganun. So, here in the fungal pneumonia, since commonly ang tinatamaan nito is mga weak yung immune system, so yung nagiging cause nito ay kadalasan sa mga spores. So, sila yung nagpo-produce ng bacteria, mga fungi, algae, and plants. So, itong spores na to, present to sa air and soil. So, kapag nag-inhale tayo or came into contact with the surface of the body, pwede na tayo makakuha ng sakit na fungal pneumonia. So, or kung malakas nga yung immune system mo, di ka pa rin ligtas. Pwede ka makakuha ng mga sakit sa balat, yung parang kati-kati, mga pula-pula sa katawan, parang buwang araw ata yun. Parang ganun. So, same sa mga nag-aalaga ng pigeons and chickens, yung mga poop nila can also lead to fungal pneumonia. So, everything actually, it can really affect your respiratory. Depende na lang kung, depende sa pag-adapt ng katawan mo sa environment. So, the next one will be the aspiration pneumonia. So, when food or stomach acid enter your lungs, yung mga particles nandun pa din, di ba? Naiiwan sa katawan. And dyan na magsisimula na mag-growth yung mga bacteria and mag-cause ng infection. So, yung aspiration pneumonia kasi, it's common in two types of people. So, yung una is yung mga older. So, yung mga matatanda who end up choking. So, choke sila because their muscle in their throat becomes weak. Kasi abang mahirapan ng umuya, no? Ganun. So, at the same time, since nahirapan silang umuya kasi matanda na sila, nahirapan din sila lumanon. So, doon pwede niya na makuha yung aspiration pneumonia. So, kasi may impact yung airways. Okay? The second one will be yung mga taong alcoholics. Mga malalakas uminom, sumusukan, nag-choke. So, ibig sabihin yung aspiration pneumonia caused by inhaled food. No? Mga stomach acid. Pwede rin yung, siguro pag naisip mo, nag-choke ka ng saliva mo or mga toxic substance, pwede rin yun. Lahat ng mga toxic substance na nag-enter sa lungs natin, pwede. So yung mga bagay na yan makaka-apekto sa esophagus natin. So we all know that the esophagus is diba? Muscular tube connecting sa pharynx natin with the stomach. Yun. So let's move forward to the signs and symptoms. So here in the bacterial pneumonia, as you can see on this slide, kapag umuubo tayo, yellow or green na phlegma, minsan may kasamang dugo. So this is typically a complication of another respiratory issue, di ba? So here in the stabbing chest, it is a pagkairita ng linings ng lungs natin. So kapag humihinga, umuubo, nababahay, makakaramdam tayo ng sharp pain. So mararamdaman mo yung madalas kapag meron kang bacterial or viral infections. Commonly, yun yung nararamdaman. So, yung ibang sign niya naman, parang pagkapagod lang, pagka-stress, ganyan. Hindi natin mapapansin lalo na sa mga panginginig, ganyan. So, medyo nakakalito kasi maraming sakit na pwede mag-lead kapag nakakaramdam ka ng lagnat. So, kailangan magpa-check ka pa din. Lalo na kung may immune system mo or may lagnat ka na. So, you should go to a hospital, to a doctor, magpa-check. So, yung ibang symptoms ng bacterial pneumonia, sometimes we feel it. So, natatakot kasi di mo alam kung pneumonia na or pagod ka lang, di ba? That's why we need proper diet, ganyan, enough sleep. Saka siguro yung mga tabletang vitamins to help to boost our immune system so that it can help us to increase durability of our body. So, sa mga older persons na medyo marami na talaga nararamdaman, no? Mga sakit, ganun. Yung bacterial pneumonia, it can easily penetrate to older persons. They are more likely feel weak or unsteady, ganyan. So, since ang pneumonia, ina-attack niya ang air sacs in the lungs, diba? Siyempre, ayan ang responsible sa paggalaw ng oxygen from lungs to blood. Kaya yung mga older people, they are much more having difficult with their breathing at the same time lower the level of oxygen in the blood. So, let's move forward to the next one, which is the viral pneumonia. Same with the bacterial pneumonia. Pag-ubo ng may kasamang phlegma, yellow or green mucus, at karamdam ng paghina ng katawan. So kung mapapansin nyo dyan, meron dyan blueness of the lips. So ang ibig sabihin yan, it's either due to lack of oxygen or siguro sobrang lamig lang, but still, something that we need to point out. Lalo na kapag pakaramdam mo lagi ng pagod ka, drain na drain ka, syempre hindi mo magpa-consult sa doctor pag ganyan. So, the more na tumatagal yung mga symptoms ng viral pneumonia, syempre the more na lumalala yung mga sintomas. Ngayon, mas nagiging delikado to kaysa sa bacterial pneumonia. So, because bacterial pneumonia, kagaya sinabi ko, can be treated with antibiotics, therapy, while the viral pneumonia usually get better on its own. Pero, paano ka nga gagaling sa sarili mo kung mahina yung immune system mo? So, syempre, hindi mo naman pwede iasa sa antibody mo. So, you also need alternative ways like go to the hospital, ganyan. So, let's move for the next one is the fungal pneumonia. So, same with the others, pagkaubo na may kasamang plema, pero dito, thick na daw yung plema. So, ibig sabihin, mga germs na nagbi-build up na sa lalamunan mo, kaya mas nagiging thick, nagiging sticker. So, ito, mas madali ma-notice yung mga symptoms since unlike the other, dito kapag huminga ka lang, you can also feel the pain and diarrhea. So, mananotice mo din agad kung fungal pneumonia yung tumama kasi makakaramdam ka dito ng pagduduwal or pagsusuka. Depende na lang kung buntis ka. Yok lang. So, next. So, dito sa aspiration pneumonia, so dito medyo talaga scaling kasi itong aspiration pneumonia. So, when we say scaling, ito yung habang tumatagal, lalong lumalala. So, the more na pinabayaan, the more na mag-suffer at magiging worse. Medyo, hindi siya kagaya ng iba na pneumonia. So, habang tumatagal, nawawala kasi na nalalabanan ng antibody yung aspiration pneumonia. Okay, so yung blue, discoloration of the skin, sign na may poor circulation ng oxygen ka sa dugo. So dito sa pangalawa sa fall odor, sometimes kaya ganyan, maaaring yung liver mo ay hindi nagpa-function. So yung mga toxins will build up in your some bloodstream and mahirapan tayo lumunon and may damage or irita na yung throat or esophagus natin. Ganyan. So, yung other symptoms ng aspiration is yung chest pain, which is pinaka-common. Halos lahat sa kanila, ito yung paramdam mo mabigat yung dibdib. Tapos kapag umubo, lalong nati-trigger, tapos sasabayan pa ng pagkatapos ng hinga mo or pagkahilo. Ganyan. So, for me, personal opinion, pag masakit nga ang ngipin mo, di ba? Nahihirapan ka. Paano pag ganito kadaming symptoms yung magsasabay-sabay mo mararamdaman? So, overall, halos lahat naman sila may onting pinagkakaiba at maraming pagkakapare-pareho. So, better magpa-consult talaga para malaman yung proper way, proper treatment. Okay, thank you.
Afternoon. So we're going to discuss today about diagnosis, treatments, and prevention. So as we all know, that pneumonia can be difficult to diagnose because the symptoms are similar to those of a cold or flu. It's possible that you won't notice your condition is more serious unless it lasts longer than the others. The diagnosis. So as we all know that if your doctor thinks that you have pneumonia, he or she may do one of the more of the following tests. So as you can see in the presentation that we have here, 5 examples. First one is abnormal bubbling or crackling sounds. So this is made by movement of fluid in the tiny air sacs of the lung. Dull thuds hair when the chest is stopped, which indicate that there is a fluid in the lung or collapse of a part of a lung. So next one is blood test. A blood test is such as a complete blood count, CBC, to see whether your immune system is fighting an infection. Next one is pulse oximetry, which is to measure how much oxygen is in your blood. Pneumonia can keep your lungs from moving enough oxygen into your blood. To measure the levels, a small sensor called a pulse oximeter is attached to your finger or ear. Next one here is X-ray. X-ray is for them to look for inflammation in your lungs. A chest X-ray is often used to diagnose pneumonia. And the last one here is a sputum test. Your doctor may test a sample of sputum or spit or a mucus from your cough to find out what germ is causing your pneumonia. You can see I have 2 photographs here that show how healthy lungs seems and how lungs with pneumonia look. In the first picture, you can see your lungs more clearly. However, in the second picture, they appear blurry and you can see the entire lungs. Other for diagnosis, if you are older than age 65, they have here the CT scan and pleural fluid culture. For the CT scans, if your pneumonia isn't clearing as quickly as expected, your doctor may recommend a chest CT scan to obtain a more detailed image of your lungs. For the pleural fluid culture, a fluid sample is taken by putting a needle between your ribs from the pleural area and analyzed to help determine the type of infection. Here the treatment. So as we all know that bacterial pneumonia is caused by the Streptococcus pneumoniae germ that normally lives in the upper respiratory tract. Bacterial pneumonia can occur on its own develop after you've had a viral cold or the flu. Bacterial pneumonia often affects just one part or lobe of a lung. When this happens, the condition is called lobar pneumonia. Those at greater risk for bacterial pneumonia include people recovering from surgery, people with respiratory disease or viral infection, and people who have weakened immune system. So for the treatment, they're given antibiotics to treat the specific type of bacteria causing your pneumonia and fluids to prevent dehydration. Next is a viral pneumonia. This is the most common cause of viral pneumonia in young children. Most viral pneumonias are not serious and last a shorter time than bacterial pneumonia. And some treatment is a doctor may prescribe an antibacterial medication to reduce viral activity. Fungal pneumonia. Fungal pneumonia is caused by fungal spores in the air, soil, or clinical environments. A non-contagious condition, its symptoms are like those of the flu: coughing, headache, thick mucus, fever, and chest pain, and among others. Fungal pneumonia is primarily treated with antifungal medication. Specific dosage and methods of administration vary based on the individual case and type of infection. Last one is aspiration pneumonia. Aspiration pneumonia is a complication of pulmonary aspiration. Pulmonary aspiration is when you inhale food, stomach acid, or saliva into your lungs. You can also aspirate food that travels back up from your stomach to your esophagus. And some treatment here is people with trouble swallowing may need to stop taking food by mouth. Treatment may include supplemental oxygen, steroids, or breathing machine.
Did you know that pneumonia is a common disease hospitalizing millions of people around the world? So, pneumonia is a common disease kasi kadalasan ng mga bacteria na causes ng pneumonia is nasa malapit o sobrang malapit siya sa katawan ng tao o common siya sa katawan ng tao. Specifically is the Staphylococcus aureus na nasa skin na siya and then pumapasok lang siya sa katawan natin pag nagkaroon tayo ng deep wound. So, bakit nagiging threat lang ang pneumonia sa tao kapag hindi siya naagapan? So, pag hindi siya naagapan, doon nagiging threat na siya sa tao. So, sobrang common niya, kailangan alam ng tao kung yung symptoms ng pneumonia. So, para nagiging dapat stock knowledge na siya ng tao na pag ito yung symptoms, naku, baka may pneumonia siya. So, for references, ayan. Thank you for the references. So, that's all for our presentation. Thank you.